Okay. So, listen, in order to stay on time, we are just going to start, and I know people will be coming in. So this is the third leg of our stool, the basic setup for this edited book format. So this is on EHRs, okay? And I won't say any more than that other than this. You may have noticed that these folks walk away with chocolate bars. And that's because, you know, what I said earlier about no honoraria is not entirely true. They do get a chocolate bar. We're really generous. Okay, I'm going to turn this over to our moderator, Ronni Solomon.
Thanks, Jeff, and good morning, everybody. I'm Ronni Solomon, and welcome to Session 3. Now, you will notice that I am not facing the audience, because we have 5 people and not 4, so this is a workaround, okay? This is the first workaround of the day. So I am absolutely delighted to introduce our stellar group of panelists. They bring extraordinary experience as healthcare leaders. For decades, they've had a front seat at the digitization of healthcare, and along the way, they have certainly learned a lot about how health IT, and especially the electronic health record, impacts patient safety. And that's going to be a lot of our talk today. It's going to be about safety and quality. So we've got Patty Sengstadt, who's nursing and chief nursing informatics executive. We have Dr. P.J. Brennan, who's a chief medical officer and senior VP. We have John Glasser. John, is it Glasser or Glazer? Glasser, thank you. I've been saying it right all these years. Who's been a health system CIO, and he's now in population health at Cerner. And we have Terry Fairbanks, who's closest to home because Terry founded the MedStar Center for Human Factors. So I think we have a great panel because we have a nursing executive, a medical executive, a CIO, and health IT developer executive, and a human factors executive. And I can't think of a better panel to have to discuss this. So welcome to you all. Why this session? Well, medical error is said to be the 3rd leading cause of death in the U.S. just after heart disease and cancer. That's still from a recent study. And medical errors often stem from the unavailability of critical information, critical patient information. And if you don't get that critical patient information, then what do you get? You get misdiagnosis. You get administering the wrong medication. You could even be treating the wrong patient, as we've learned in our research. So the EHR really holds incredible opportunities for eliminating these patient safety risks and hazards. And at least over 80% of hospitals and 50% of physician offices have installed a basic EHR. And that's a 9-fold increase since 2008. So this technology has spread like wildfire. But what does the AMA say? The AMA says that physicians spend twice as much time documenting care as providing care. I know some may dispute that, but that's the statistic. And that EHRs have become a source of dissatisfaction. So given the amount of time spent on documentation, and given the dissatisfaction, do they invite workarounds? And if so, what are those workarounds? So our panel's going to talk about that today. And we're going to hear about what kind of workarounds does the EHR invite, what's the motivation for those workarounds, what's the consequence, is it favorable, is it unfavorable, is it like my colleague Dr. Ellen Deutsch says, trash or treasure, and she'll be speaking at the next session. Can improved knowledge about workarounds lead to improvements? Can it help improve user-centered design? So are workarounds pejorative, or are they illuminating? So here's the approach for this session. First, we're going to get a 5-minute take from each of our panelists. And then I'm going to present some case scenarios that have actually been shared to ECRI Institute through our patient safety organization, our Partnership for Health IT Patient Safety. So we have, these are real situations, of course, completely de-identified and anonymous. Then we're going to have a panel discussion about those case studies, and then we'll open it up to questions and comments from you in the audience. So with that said, we'll get started. Our order is going to be Patty, PJ, John, and Terry. So we'll start with Patty.
All right. Thank you.